As a med student, you'll need to know how to manually take a patient's blood pressure for OSCE exams, labs, and in the clinic if an automatic cuff isn't available. In this video, I'll go over my Welch Allyn trigger style sphygmomanometer. Not all blood pressure cuffs are created equal. Traditionally, the pressure was released from an inflated cuff using a dial, but now there are trigger mechanisms available. Maybe it's the cyclist in me, but I like the feel of the trigger mechanism. In this model, if you push the top of the trigger, it will lock into place. This is the position you need for inflating a cuff. Then, to slowly deflate the cuff, you gently rock the trigger mechanism down until you feel a stop. Hold it there, and it will deflate at a constant rate. Finally, once your Korotkoff sounds disappear, you can fully release the cuff pressure by pushing the trigger all the way down until it locks. One downside to this trigger mechanism is you don't have as much control over the deflation rate as a traditional dial. It's difficult to see in the video, but the deflation rate is a bit slow. You can push the rate a little faster, but this takes some practice because it's easy to push the trigger too far and then fully deflate. I think the dial face is super easy to read. One tip is your blood pressure should always be an even number because of the dial's increments. So don't make that mistake on OSCE exam day of reporting an odd number for your blood pressure reading. To get an accurate blood pressure reading, it's important to select the correct size cuff for each patient. These cuffs show you where you should line up the cuff to the patient's brachial artery, and they have a range where that artery alignment should be within. If it's not in that range, then you need a different size cuff. It's easy to attach the cuff of your sphygmomanometer. The clasp squeezes to release, and it's a simple push and snap to attach. I've got my cuff on my arm so I can show you how the trigger mechanism works. With the trigger locked in the top position, inflate your cuff, and it's best practice to inflate until you don't feel the radial pulse, not just inflate to a default 20 over the reference 120. Then, once you've placed your stethoscope on the cubital fossa to listen for your Korotkoff sounds, gently rock and hold the trigger down to deflate slowly. Watch the gauge as you're deflating, so you can note the pressure when you hear the first Korotkoff sound, that's your systolic, and then again when it disappears, that's your diastolic. After the Korotkoff sounds disappear, you can fully press the trigger in the down position to quickly deflate the cuff the rest of the way. For storage, I'd suggest detaching the tube, otherwise you can get a kink because of how it sits in the case. And it's important to keep your blood pressure kit out of intense heat, like your car in the summer, so it doesn't decalibrate the internal cage. In the beginning, I wasn't sure if I'd like the trigger gauge, but after using it for a while, it's pretty easy. It just takes a little practice getting used to the mechanism. Bottom line, whatever blood pressure kit you get, just be sure to practice so you become familiar with it. Okay, that's it. Blood pressure equipment is pretty straightforward. Don't forget to subscribe to ScrubNotes so you don't miss out on future videos, and I'll see you in the next one.